Now, for the corneal disorders, we have some surgical procedures called keratoplasty, okay, called keratoplasty. So, what is keratoplasty? Keratoplasty means the replacement of the corneal layers or the whole cornea, okay. So, we have, which is also called, keratoplasty is also called corneal grafting or corneal transplantation, okay. So, we only replace the disease layers or the whole cornea. On this base, we have types of keratoplasty. We have limellar keratoplasty and we have penetrating keratoplasty. Limellar keratoplasty means that only we replace the disease layers, okay. So limellar keratoplasty is of two types. It is superficial limellar keratoplasty and deep interior limellar keratoplasty. In superficial limellar keratoplasty, we only replace the superficial layers, okay, up to the interior stroma, okay. Up to the interior stroma, we only replace these layers of the cornea. So any disease, any pathology which is involving these layers and is not responding to any medication, then we replace these superficial layers, the epithelium, the Bowman's layer and the superficial stroma, okay. When we replace these layers, this is called superficial lamellar keratoplasty. Okay, with any pathology or disease involve the deep stroma, so we will then replace these whole layers up to the deep stroma, means up to the descemet membrane. With any pathology or disease involving the epithelium, the whole corneal layers up to the descemet membrane, and when we replace these layers, this is called deep interior lamellar keratoplasty, okay. Now we will discuss the second one, which is the penetrating keratoplasty in detail, okay. And this is important, okay. This is important. So the penetrating keratoplasty mean that we replace the whole cornea. We are replacing the whole cornea from the epithelium, means that we will remove the whole cornea, okay. We will remove the whole cornea and will replace it. This is called penetrating keratoplasty, okay. So what are the indications of penetrating keratoplasty? When we have to do this procedure? There are some indications. For example, if there is the corneal opacity, okay, there is the corneal opacity, deep corneal opacity, which is not responding to any therapy, okay. So corneal opacity is not responding to any therapy. We have the bullous keratopathy, okay. So the bullous keratopathy, in which there are the formation of bullae in the cornea, bullous keratopathy. When we have the perforated corneal ulcer, as we have discussed previously, when we have the descemetocele, okay, in which the descemet membrane bulges out, when there is the perforation to the entire cornea, this is called perforated corneal ulcer. So in the descemetocele, in the perforated corneal ulcer, we are doing the penetrating keratoplasty. And we can also do penetrating keratoplasty for cosmetic reasons, but it is very rare indication, okay. So these are the indications for the penetrating keratoplasty. Now the procedure. How are we doing the procedure? First of all, within 6 to 48 hours of death, we will remove the eye. Okay, we will remove the eye and we will preserve the eye. We can preserve the eye at 4 degrees centigrade for 2 days. So if we remove the eyeball of the patient and we keep the eyeball at 4 degrees centigrade for 2 days, it can be preserved for only 2 days if we keep this eyeball at 4 degrees centigrade, okay. There are other mediums through which we can preserve the eyeball for longer period of time, but this is one method of preservation, okay. Now we have removed now and we have preserved the eye, let's suppose, at 4 degrees centigrade for 2 days. Now what is the procedure of corneal replacement? First we will remove this. If for example, if this is the donor's healthy cornea, okay, we will remove the donor healthy corneal button, okay, within 6 to 48 hours of death, okay, we will remove this button, and then we will remove the recipient, the patient's corneal button. This is the diseased cornea, okay. So we will replace the entire corneal button of the recipient. Okay, the entire corneal button of the recipient has been removed. Now we will take this donor's corneal button, this healthy corneal button, and we will place it on the diseased cornea of the recipient, okay. And then we will suture it. Okay, so this is the procedure. So this is the procedure for corneal transplantation. Now, what are the condition in which we should not do penetrating keratoplasty? These are called contraindications. So what are those conditions? All the conditions which are involving the surrounding areas of the cornea. For example, if there is, this is the cornea, okay, of a normal individual. If there is any problem with the eyelid, such as entropia, trichiasis, okay, any other disease such as the surface disease of the cornea, when there is any active disease of the cornea, such as when there is ocular secretial pemphigoid, Stevens-Johnson syndrome, keratitis, infective or non-infective keratitis, okay. So when there is any problem with the surrounding region of the eye, on the surface of the eye, if there is any problem on the surface, or if there is any problem, okay, in the eye itself, okay. So when there is problem in the interior chamber, such as interior uveitis, or there is problem with the posterior chamber, okay, such as posterior uveitis. So in these all conditions, we shouldn't do penetrating keratoplasty. These are called the contraindications, okay. We will not do in any active disease of the eye. As I have mentioned, we will not do penetrating keratoplasty. Now, complications. What are the complications of the penetrating keratoplasty? The complications are they are divided into the early complications and late complications. Early complications can be, for example, if there can be the leakage of, as we have removed the donor's cornea and we have sutured on the recipient corneal button, okay. So when there can be the leakage, okay, the wound can be leaky, there is one problem. So when there is the leakage, we know that the iris can prolapse, okay. When there is the leakage, okay, for example, if this is the cornea, okay, if this is the cornea, so if there is the leakage, as there is the leakage, so the iris can prolapse out, okay. The iris can prolapse. The third one is that there can be a secondary bacterial infection in the interior chamber or posterior chamber because of the leakage. The fourth one is that due to these infections, there can be the secondary glaucoma, okay. So there can be the leakage, there can be the prolapse of iris, there can be the secondary bacterial infection and glaucoma. So these are the early complications of penetrating keratoplasty. The late complication, and is the most common complication, is the rejection of the graft, okay. So we know that it is a foreign antigen for the body. If we remove the donor's cornea and we implant on the recipient, it means that it is a foreign antigen. So the body will treat it as a foreign antigen and will activate the immune system and will start rejecting this graft. So this is the most common in late complication. And what will happen in this complication? The whole cornea is now, this whole healthy cornea will be, there will be inflammation, edema, etc.